Welcome to the Deep Dive. Today we're getting to something really vital, I think, vitamin D blood testing. Our goal here is to understand why this vitamin is so crucial, what the real benefits of testing are, and importantly, how easy it can be to get tested, especially using local info like we found on the Blood Test UK website.
Absolutely. And that local access piece is key. It turns vitamin D from just a concept into something practical you can actually manage in your own life.
Right. So let's kick things off. When we talk about a vitamin D blood test, what exactly is it measuring? Is there one main thing they look for?
Good question. Essentially, it's a diagnostic tool, a blood draw. And the main marker, the one that gives us the best insight, is called 25-hydroxyvitamin D.
25-hydroxyvitamin D.
Yeah, that's the main storage form circulating in your blood. So it reflects intake from, sunlight, diet, supplements, the whole picture.
Got it. And stepping back, why is getting a handle on this number so important? Why all the focus on vitamin D?
Well, what's fascinating here is how broad its role is. We all know about bone health, right? Helping absorb calcium and phosphorus.
It's classic role.
But the research now goes way beyond that. We're seeing strong links to immune system function really important. And some studies even suggest it could play a role in reducing risks for chronic things like cardiovascular issues or maybe even certain cancers.
Oh, okay.
And don't forget mood and general well-being. That winter dip many people feel. Sometimes low vitamin D is a factor. A test can help figure that out.
That really highlights the value. Which brings us to being proactive, right? Because knowing your own levels feels like where the real power lies. What are the main advantages of getting tested regularly?
You've hit it exactly. It's about early detection, first off. Catching a deficiency before it causes bigger problems.
Right, before you really feel the effects.
Precisely. And then it's about personalization. The test results guide you. Maybe you need dietary changes, maybe specific supplements. It helps tailor the approach.
So it's not just guessing.
Not at all. Plus, you can track if what you're doing is actually working. Are those lifestyle changes boosting your levels? And honestly, there's real empowerment in just knowing your status, understanding your body better.
That makes a lot of sense. Now, connecting this to the bigger picture, you mentioned local access earlier. How does knowing where to get tested fit in, especially in places, say, like the UK?
Yes. That's critical, especially here. We often don't get enough consistent sunlight, particularly outside of summer, so relying on sun alone, it's often not enough. That's why having readily available local testing options, like the examples for Romford we saw highlighted on that Blood Test UK site, is so important. It makes proactive health management much more feasible for people.
So let's talk specifics. For someone listening, maybe they're in an area like Romford. What kind of options did our source point out?
Well, it's at a good range. You've got your standard NHS routes like local GP surgeries and places like the Romford Health Center. Then there are high street options like Boots Pharmacy often offers services. And for convenience or perhaps privacy, there are private routes too. Companies like Medichecks offer at-home finger prick test kits.
So quite a few choices then.
Definitely. And when you're choosing, it's worth looking at things like, official accreditation, maybe patient reviews, just to ensure you're getting a reliable service.
Good point. And what about the practical side? Anything you need to do before the test? And how are the results usually interpreted?
Generally, it's pretty simple. Sometimes fasting is recommended maybe for 4 to 8 hours just to ensure accuracy, but always check the specific instructions you're given.
Oh.
As for results, a level below 30 nanomoles per liter, or unmol, is generally seen as deficient. But interestingly, many experts suggest optimal levels for overall health might be higher, perhaps closer to 50 or even 75 nanomoles.
So there's deficient and then there's optimal.
Exactly. Knowing your specific number helps you understand where you fall on that spectrum. And having that local testing info makes acting on it much easier. It helps you make informed choices right there in your community.
And if you do find out you're low, what are the typical next steps?
Usually it involves a few strategies. Supplementation is common, and vitamin D3 is generally preferred because it's, better absorbed by the body.
D3, right.
Then dietary tweaks, think fatty fish like salmon or mackerel, fortified foods like some cereals or dairy products, and of course sensible sun exposure when possible. But the key thing really is talking it through with a healthcare provider.
Always the crucial step. Get that professional advice.
Absolutely. They can recommend the right dosage and approach based on your specific levels and health situation. It's not a one-size-fits-all thing.
So wrapping this up, it seems pretty clear. Understanding your vitamin D status and, crucially, knowing where you can easily get tested locally is a really significant part of looking after your overall health proactively.
It truly is. And perhaps a final thought for you to consider. Think about how identifying and actually using these local health resources like vitamin D testing facilities can fundamentally shift how you manage your health. It makes proactive care less abstract and much more of a tangible reality right in your own neighborhood.